right, so how are you feeling?
I'm okay.
You feeling okay? All right. So I know the other Dr. Lee did the treatments, right, and everything, the liver treatments.
Yes, the Y90.
Yeah, so I think the question is, what do we do next and everything, kind of based off of our discussion that we had last time.
Mm-hmm.
So I know you had the upper endoscopy as well, and
Mhm.
they didn't see any, bleeding or anything like that.
Right.
So usually the treatments that we would recommend is some type of kind of immunotherapy,
Mm-hmm.
infusion and everything.
An infusion meaning injected?
Like an IV infusion,
Okay.
like going through the vein.
Okay.
Usually these infusions are given either once every 3 weeks or once every 4 weeks, depending on the regimen
Mm-hmm.
that's done.
And for how long?
So these types of treatments are somewhat indefinite,
Mm.
meaning that you would have to be on some form of treatment to control the cancer in terms of what's remaining after Dr. Lee's treatment. So the start of treatments really kind of depends on when you would like to start and everything, because Dr. Lee went in and he treated kind of the larger lesions in the liver, but what we know is that probably there's going to be potentially smaller lesions.
Mm-hmm.
So one option is to, let's say, wait until your follow-up MRI to see what is left in terms of the disease that's remaining, and start treatment then, or to just go ahead and start treatment now. Both of those are very reasonable options. There will again be a time where you're going to need treatment. That's for sure. But you do have a little bit of time and everything to get there. You could say, hey, I want to recover a little bit from this last treatment and everything, and wait until the next scan, everything, and depending on what that scan says, then we'll start treatment in that sense.
Well, the next scan isn't for 2.5 more months.
Yeah.
And I think if she's going to do it, she might as well start now, because she didn't have any side effects from the Y90.
Okay.
But we wanted to ask you, based on the condition of her liver, what would be the protocol if, say, she began to have severe side effects, like yellowing, or not the rash and all that can be dealt with, but the more severe things.
Yeah. So the treatments, like you said, can have side effects whenever you're activating the immune cells to attack the cancer. The immune cells can attack other parts of the body, including the liver itself, right? So if it attacks the liver, then sometimes you have to give what's known as steroids to try to calm the immune cells and everything.
Now that you mentioned steroids, they give her steroids with the Y90. And I've never seen her any better than them. Can't we just start the steroids anyway?
No, because the steroids also, again, suppresses the immune cells.
Oh, I see.
So then that limits the immune cells from, attacking the cancer.
Okay. So that would be given if we notice yellowing.
If you only notice, like, severe toxicity, from it. And again, like, that is the risk with treatment. Like, again, we have to be honest about that. So if the immune system, let's say, gets too active, and we cannot reverse it, then that's serious. So there's always that chance, right? That it's not 100% that we will be able to completely reverse any type of liver injury.
And with her, a liver injury could be fatal, because her liver is so unhealthy. So it is a risk. Do you feel that in her situation, say it was your mom, what do you think you would opt for?
Risk benefit would probably still potentially favor treatment.
Yeah.
From this.
We kind of feel the same.
But there are risks involved, and we have to let you know.
Okay. So would she be able to start it? Like,
yeah, if you're okay with it, like, you know, we will initiate the process, and you know, potentially you could start it like, you know, next week, you know, sometime. So this is like a infusion that you would come into clinic, you would get the infusion like, you know, once every, you know, 3 weeks and everything, and then you go home. So one of the other side effects of the infusion is to monitor your blood pressure, because sometimes it can elevate the blood pressure.
And she already has high blood pressure.
Yeah, so we'll have to monitor that and everything. And we
Okay.
might have to adjust your blood pressure medications. Depending
Okay.
What is the less invasive on this kind of treatment? What is the less invasive?
Well, the infusion
The
is,
infusion is like, you know, for the most part, it's fairly well tolerated, I would say, and everything. This is probably the less invasive, but like I said, there's always the risk of overactivating the immune system to attack other cells in the body. There's a risk of, you know, high blood pressure from one of the medications. There's also, and as you can imagine, if the blood pressure gets, you know, really high, then there's a risk of stroke from that, right, and everything like that. So again, those are low and everything, but those are the things that you have to monitor and everything like that, because those can be serious.
and how many times a day would she be checking her blood pressure?
I think usually like you want to check like, you know, maybe once or twice a day and everything. That's it. And
Okay.
to monitor that.
Okay.
How long will the side effects take in terms of a month or two?
Yeah. So again, you might not have any side effects and everything.
No, I
the
said-
treatment and everything.
How, if I get the side effects,
Yeah.
how long will I get them? For how many days, weeks, side effects? They don't go away?
What he was saying was that we don't know what the side effects could be, and
Yeah.
you might not get any. But if you get the severe one, which we're concerned about, is that your own immune system attacks your liver, that could be that could even be fatal. But he thinks that the the benefit outweighs the risk, because the chances are not great that could happen. He's just warning you that it can happen. And if it does happen, then you would have to start taking some steroids to reverse the immune response to get it back on track. But you can't predict how long that would last. That's impossible for them to predict that. They would be trying to manage both things now, an additional thing, you know, and weighing, and, you know, you might end up being hospitalized, you know, it just depends. It could be like Eli. I mean, you can't predict how you're going to respond even to the therapy that they would give you in that instance. That can't be predicted.
Yeah. Correct.
So if they get really bad, I understand I could come here, right?
Yes.
To have medications for the side effects?
Yes.
But the specific side effect that we're worried about is the immune response, your own immune system attacking your liver.
Yeah.
And your liver is already very compromised. It's not a healthy liver. So that would be an acute situation where we would have, you know, it could be touch and go. So you really have to think about that, because, you know, that might not happen, and it's not even a great chance it will happen, but it's a possibility. And so that's what you need to think about, you know, because if something like that were to happen, you might not survive something like that.
Yeah, so that's the one risk, and then the other risk, like we said, is like if it's, you know, uncontrolled blood pressure, can potentially have that stroke risk, right? And then there's also this, you know, small risk, about 5% risk of potentially like, you know, bleeding and everything. so that's why we did the endoscopy, to make sure that there's no dilated blood vessels and everything. You don't have that, so that minimizes the risk, but there's always that theoretical risk, everything that's there. So those are probably the three big things, everything to kind of consider.
The stroke is scary too, but that would be managed with the blood pressure medication?
Yeah, obviously you try to control the blood pressure and everything as best as to minimize that risk and everything.
Is there a percentage of people that
Yeah,
happens to?
so the stroke risk is probably about anywhere from 3 to 5% and everything.
Okay, so the benefits also outweigh that.
Yeah, bleeding risk, like I said, is about, potentially like, 5%.
And what about the liver?
Liver, severe toxicity to the liver is probably about, I would say 8 to 10%. So again, like, doesn't happen to most patients, but there is that the potential risk.
So what he's saying is that most likely none of those things would happen, but he has to give you that information so that you're aware that it's not, guaranteed that this is going to prolong your life if these kind of things happen. There's a danger that it could make things worse. But you have to decide, what's your goal with the immunotherapy, because like he told us before, it could add months to your life. There's a possibility that it could make you live longer. It could be managed until the end. You could stay on immunotherapy, but you also have to decide, are you going to risk shortening your life if you have these severe side effects? So he's being very straight about it so that you can understand. Okay? And remember, he gave you the example last time, like he said, that a lot of people that take immunotherapy, they have a goal in mind, like I want to reach this date, keep me alive for this long because I want to be there for this, So, you have to think about that. Or do you not want to risk it, and then you already had this treatment, the Y90, and you don't want to risk it because there's not a specific date you want to live towards. You just want to be happy and healthy until the end, and not take risks.
Yeah, because that's the quality of life.
I know. So I mean, this is, she put it very beautifully and everything, in terms of these are the things that I think you have to think about and everything.
We've been having a hard time deciding.
Yeah.
And she's been going back and forth.
Yeah.
And what all of our kids were all concerned about the risk of the side effects. And so, I think that the benefit still outweighs those risks. But ultimately, I feel like, there is no really goal of it. Her goal would be cancer free and live another 10 years, right? Obviously, that's everybody's goal.
Yeah.
But if that's not achievable, and the most she's going to get is an extra 3 or 4 months, is it really worth it?
Yeah.
Yeah, no,
I know.
Because otherwise, if I don't do experiment with the one that I got, I didn't have any side effects. And I feel really good, but I don't know for how long.
Right.
So it with the balance with this other treatment.
Yeah. So as we discussed, again, this is a very individualized decision, and I can't tell you what to do and everything. I can just be kind of like a provider in terms of giving you the information and everything. I think on average, you'll probably, if you don't do anything, I think you'll probably be okay for 6 or 7 months and everything. Probably not an issue. Like maybe longer than that and everything. I don't know, right? But that would be probably the average that our best guess in terms of, before the tumors maybe, start to grow again, or, other things that can happen. With our treatments and everything, on average, you'll probably gain, maybe another year with treatment and everything. But, some patients do really well and they can get, long-term durability of control, everything. Can we completely take this away, like you said, and everything? No, we can't take it away and everything. So that's the decision that I think you'll have to, decide ultimately in terms of what to do. Because, what I can only provide you are averages, but that there are people that do much better than the average, and everything like that, right? For either way, right? And everything like that.
Depends
So-
on the system, my system.
Yeah. So again, I think you'll have to decide that.
And now, if she were to decide to do it, do we call you and let you know?
Yeah, just let us know, and then we can initiate the process.
And then to initiate the process, what does that involve?
We will submit for insurance authorization and then scheduling, for further infusion.
For what?
Insurance authorization.
Yeah.
And is there a
schedule
chance the
for-
insurance will deny it?
Should not, because these are FDA approved treatments.
Oh, they are, okay.
I think the worst would be that it attacks the liver.
Yeah, that's what
Yeah.
we were saying.
That's it.
And that can happen.
Yeah.
And you need to be aware of that.
And what would be for me to see the symptoms of this happening?
You would turn yellow,
Yeah,
yellow
you could get
eyes.
jaundice, you could have abdominal pain, you could feel weak.
And then you stop the treatment.
We would have to stop the treatment and try to reverse it with steroids, but again, it's not guaranteed that we can, reverse it, because it depends on how serious it is.
In other words, you might go into liver failure and they may not be able to help you get out of liver
Yeah.
failure.
Exactly.
They will try, but they may not be able to. So then you've given away the possible 6 or 7 months of your life. You've given them away then if that were to happen. Or that may not happen and you might gain, 6 or 7 months. But he can't predict, nobody can predict what will happen.
It's a tough decision.
Yeah, no, I know.
And
Think about it.
Yeah.
Think about it. It's
Yeah.
okay. We have
Thank
time.
you. You've
We
been
have
very
time and
patient.
everything. Think about it.
Yeah.
And then just let us know.
Okay.
Okay.
Thank you.
All right.
Thank
Okay.
you.
All
We
right.
appreciate
No
it.
problem.
Thank you, Dr.
Okay.
Lee.
No problem.
Okay.
Take care. Okay.
Okay.
Yeah.
When
Bye-bye.
will I see you again?
Oh, you just let us know.
Yeah.
Yeah. We can always. Yeah. Okay.
All right.
All right. Okay.
Thank you.
All right. No problem. Take
Thank
care.
you.
Yeah.
Bye-bye.
Ahí donde lo toca.
Sí.